Good afternoon. My name is Professor Usama Hadi. I'm a rhinologist, skull-base surgeon from the American University of Beirut. I've been invited to this meeting on several occasions to give different topics. My recent discussion and panel discussion was basically on the frontal sinus. The frontal sinus, as you all know, is a complex and complicated anatomical structure. The difficulty of the sinus is that it's considered the last frontier for surgeon to approach surgically as well as medically because of its complexity. First, it is a complex anatomical structure located basically in difficult area in the sinuses and in the head and neck area. It is surrounded by the orbit on both sides and by the brain from above and posterior. So any error in judgment or in lack of surgical expertise will lead to a catastrophe for the patient. Besides this location, the anatomical structures of the sinus itself and of the frontal recess, outflow tract as they call it, is complicated by diffuse and multiple air cells, the agarnasis cells, the supraorbital ethmoidal cells, the frontal sinus air cells. So all of these tend to make the dissection of that area very challenging and very difficult. Top on that, if the patient has a disease, like inflammatory polyps or allergy or any diseases that might distort the anatomy and make the surgical approach even more difficult and more dangerous. Especially if patients have tumor also, they tend to grow into the sinus and they tend to grow into the orbit or into the roof, making the resection more difficult and putting the patient at a high risk of complication. It's important to not approach this area unless the patient and the physician are well trained to handle this process, and the patient has to understand the potential risk of the surgery. The approaches varies technically from a simple frontal sinus resection or removal of disease to a complex draft 2A, 2B, and even a modified Lothrop procedure. Even patients can be involved in external approaches or can be subjected, to external approaches to remove tumors that have extended into the frontal sinus, making it difficult to remove from below with the endoscopic techniques. Not only that, sometimes you need to combine both endoscopic approaches to achieve proper access to the nasofrontal recess outflow tract, combined with external approaches to be able to eliminate and remove any tumors that are present. So you can have a direct endoscopic approach, that is complicated by multiple anatomical difficulties in the structure of the ethmoid cells and the frontal cells. And on top of that, the physician has to be well versed in external approaches to the frontal sinus so that he will resort to that in case he's not able to achieve the surgical cure of the disease with respect to the patient's interest. Definitely preoperatively CT scan and MRI would help roadmap the approach to this complex area and will help guide the surgeon to safer surgery. Nowadays, new technologies also have been employed, like the navigation systems, which help the surgeon to guide the resection and to avoid inadvertent injuries to vital structures in the head and neck area, such as the brain and the area of the orbit. This surgery is very important, requires good formal training to be able to perform, and has to be coupled by multiple sinus courses whereby the surgeon get familiar more and more to the approach that is needed to perform this surgery. One should not engulf in this surgical endeavor unless he's fully prepared and has all the armamentarium available, from proper instrumentation to shavers to drills to navigation system, so that he affords the patient the best safety procedures.